What questions or problems are you working to solve?
So the question I'm working to solve is around improving health access across the world, which requires a broad knowledge and expertise. I think we all know now, after COVID, that no disease can be confined by a national border or ocean. And at the Havey Institute for Global Health, where I work, our goal is to expand knowledge, capacity, and equity in global health through transdisciplinary research and education partnerships. So I try to find the best ways to connect faculty, residents, students, and other collaborators that we have across the world to work together for hopefully a long time in a sustainable way to tackle these problems. Most of these problems disproportionately impact low and middle income countries. We know now, of course, that with climate change, these problems really have only increased and will continue to increase over time. So we're working to tackle these problems in a holistic way, both working on these big picture problems, but also achievable smaller problems that we can tackle in a shorter amount of time in a specific location that may serve as examples for other locations that are similar. So we have 10 centers and programs at the Havey Institute for Global Health, where I serve as the administrative director. And these are centers and programs that were built around the expertise that we have at Northwestern. There are many other centers and programs that probably could exist, but we really try to look across our faculty and see where we have a locus of expertise. So we have centers in surgery, oncology, infectious disease, education, cardiovascular health, neurology, health policy, biomedical engineering, and pathogen genomics. And these sound like a lot of different expertise, and they are, and oftentimes they're working strictly on that issue or problem in which they're focusing on, but they also work across centers quite a bit because a lot of these problems are intertwined with each other. And then, just to touch on my role, I'm a jack of all trades in some ways in global health as the administrative director of kind of spinning all of these plates at the same time. But it's really great to have someone in this kind of role because they touch on every single thing that we're doing. So I'm involved in the management of all of our research projects. So I really know all of the partners, all the topic areas, the pitfalls and the successes, and the same with all of our education programs. We send, nearly 50% of medical students on month-long global health rotations a year pre-pandemic, and now we're starting to ramp up again. And so I know all of those partner sites, and they don't need just, students coming for global health rotations. They have other issues too. So we do a lot of matchmaking with faculty. And then I know, of course, the work of all of these 10 centers and programs. So I'm really helping to identify where is a problem or a need and how can we resolve that.
Why have you chosen to pursue this question or problem?
I guess it's been a long and winding road, but I've always been interested in not only how we see our own healthcare, but how others see our healthcare. So I started my career in anthropology, actually, and have a master's degree in anthropology, which I would actually recommend for anybody interested in global health, because you really have to understand culture and history and what impacts, how people think about making decisions, and what societal pressures come into play. All of these things are vitally important, I think, to understanding the totality of one's healthcare, not just abroad, but even here in the United States. We see that our handling of the COVID pandemic and the reactions people had to vaccination is really, based in the culture and upbringing that they had in many ways, and the messaging that they're getting in popular culture all around them. So I started my my career in global health, honestly, in anthropology, and very quickly started getting very interested in medical anthropology and how the ways people's health is talked about them for them really impacts the flow of funding, the kind of global perceptions of different cultures. And so from there, I worked in that field for quite a while, and then from there decided it would really behoove me to pursue my master's in public health. So that's the direction I went after that, and actually got my master's in public health at Northwestern, and really started looking more at infrastructure and health systems, and how one's health system that they live in really impacts the care that they get and the long-term outcomes in that place. So that includes everything from physical infrastructure to the workforce capacity building to health financing as well. And it really does have an impact. I think even in the US, there's such a variety of quality of healthcare that you can get depending on where you live. Ended up working in capacity building at the Centers for Disease Control and Prevention, and then later in emergency preparedness and response on the Zika virus response with the American Academy of Pediatrics. And working with the Institute for Global Health was really a dream, because I was able to focus on so many different topics, and I can engage where my expertise is, but I can also learn at the same time and be surrounded by a really thriving group of people who are all bringing different things to the table. So that's what, that's sort of where I went with this topic, and I've just always honed in on health and how that impacts us, and especially how external factors impact whether we live healthy, long lives, or whether we have, ailments that impact our life and our ability to work and to be happy in our private lives.
As individuals and collectively as a society, what can we do to help answer the questions or solve these problems?
I think that it really depends on what you want to do, of course. There's really a place for every expertise in the field of global health. We have historians, just at Northwestern, we have historians, anthropologists, political scientists, and economists, engineers, business people, and of course there's public health and medicine and policy experts. So across the range of individual fields of expertise, there's a ton that can be done. We also see a lot of private organizations like Coca-Cola, Hewlett-Packard, or Gates getting involved in helping think about things like logistics and financing. So there's tons of area for involvement. I would just urge a few things. I would urge collaboration across expertise. And I think that's something that is always a challenge, no matter what field you're in, is working with those that come at a problem with a different point of view. But that's vitally important. We try and encourage that by developing things like case competitions and other areas where we intentionally bring together different disciplines to work together. And that's really important. But I would also urge that before embarking on anything in global health, you'd really look at the field, look at the problem that you might be interested in, and see what's already been done in that area. There likely has been something already done, and I think, again, we can learn from the successes and we can learn from the failures, but it's important to know going in that this is likely not the first time something has been tried. and what can we learn from other places where it's been tried. So there's of course so many journals and organizations that publish all of these things. So really kind of spend that time getting to understand the problem and what's been done in that area. And then I would also urge that we really invest and embed in ourselves this idea of ethical partnerships. So we don't think of it as a us versus them anymore. Partnerships are about working equally together in the long haul, for the long haul, and really not about this kind of like fly in, fly out mentality anymore. You really have to understand the history, context, the political will, and of course the social determinants of health that are happening in that location. So really spend that time before sort of trying to do anything. Really know the issue, develop that great relationship with your partner, know the country, the site, the health problems, the whole, universe of things that might come into play with what you're particularly trying to tackle. And of course, this kind of leads into this idea that partnerships are not about deciding that you have a solution to the problem before knowing the context in which you're working. So, spending that time to really understand the problem, honestly assess what can be done, where your expertise is. You don't have to be an expert in everything. And you might not even be an expert in this area you want to work in. So really be honest with what can be done and what resources you have at hand. And understand that there are going to be structural things that come into play that are going to delay it. So if you think you're going to do something in 6 months, you're likely going to need a year. So that's just something to really honestly assess before you go in. And then, of course, checking in along the way and course correcting along the way. So not just in terms of the project, but in terms of the partnership itself. Connecting with each other. How are things working? Are we, is one group handling too much or more than they can handle? Are there communication issues? Are there resource issues that are coming to play? Bandwidth issues? All things are so important and could be avoided, but we just have to be willing to go there and spend that time valuing the partnership as much as we do the issue of the problem. And so, I think that we all can have a role to play in global health, whether or not we even are just someone who donates funds to, a relief organization or the WHO. I think there's a lot to be said for not trying to start something new where we don't need to. Again, there's so many different ways. It really just would take that reflection of what am I bringing to the table? How can I get involved? Who can I talk to learn more and to make connections?